So we will again be expanding the amount of data that is put out for the public. This will add to a daily report that already includes extensive data around COVID, including case data by zip code, by age, by gender, by county, by nursing home, among many other items of information. Thanks to the health department and employees for their aggressive efforts to collect and disseminate this data and for their willingness to be so transparent. The extensive data released today and in prior announcements has really driven a lot of action. That data was part of the driver for our action to protect seniors when they go to grocery stores, and that data was part of the reason for the aggressive efforts at nursing homes. Just a reminder that at nursing homes, visitation is now barred. Nursing homes must additionally adhere to guidelines on social distancing. Employees at nursing homes must have fever checks, and those with fevers must be prohibited from entering, and nursing homes are required to implement extraordinary protocols on sanitizing. Additionally, if the legislature convenes this year to talk about COVID, we will be asking them to revisit the 2015 decision to make it harder to hold owners of nursing homes accountable for what happens at nursing homes. This 2015 change in law provided that the owners of nursing homes were not liable for what happens at nursing homes. In my opinion, that law had real effects on accountability, on staffing levels, and the protections that are in place to protect residents at nursing homes. Because of the extensive data that we collect and release every day, we are expanding our efforts to protect prisoners and the detainee population. We have 0 confirmed cases in the prison population at the penal farm at Shelby Farms. But nevertheless, we're taking aggressive steps to prevent outbreak and to reduce the chances of outbreak should it occur. That includes things like screening everyone who enters the facility. That screening includes a daily temperature check and a questionnaire to ascertain whether the individual has been exposed. Visitation has been eliminated, but prisoners are permitted to have virtual visitation with their loved ones. The virtual visitation program at our penal farm is offered once a week for 25 minutes for free. We, of course, have had several cases at 201 Poplar, so we are ramping up our testing there. Among other actions, the health department expects to soon be able to administer 400 tests at the 201 Poplar facility. Finally, the data has given us reason to have some guarded optimism. We have been on somewhat of a downward trajectory since about a week ago when we had our high. So on April 17th, we reported out 108 new confirmed cases, and on April the 18th, we reported out 115 confirmed cases. And today, as you know, there are 50 new confirmed cases. The data suggests that this is the right time to begin entering the next phase of this two-front war. On the one hand, we're fighting a war against COVID-19, which is primarily an effort to save lives, and this is our top and most important priority. On the other hand, we're fighting a war at our rear. The second fight is a fight to save and preserve livelihoods. That second fight is also important because we know that lives have been shortened by poverty, by food insecurity, and by loss of job. The municipal leaders are working closely together in partnership to outline a path forward, and the process of reaching consensus could only be days away. Thus, I am renewing my emergency declaration and executive order for Shelby County through April the 30th. I do expect to renew parts of that executive order even after April 30th. For instance, we will likely have an emergency declaration for Shelby County in place for a significant period of time. However, after April the 30th, I do anticipate there will be changes, even significant changes. These changes will be necessary because going forward, we want to work to align the various municipalities and avoid confusion and duplication. Additionally, these changes will be necessary as we move toward transition, toward adopting a phased approach to recovery. With that, at this time, I'd like to invite up, on behalf of the Health Department, David Sweat.
Thank you. And so as we reported this morning in our update on numbers, we have 1,981 confirmed cases reported in Shelby County at this point in time. And that does represent an average over the past week of 35 to 50 new cases daily. But we're a week out from our high water mark that the mayor just mentioned, where over a 2-day period we had 223 new cases reported last Thursday and Friday a week ago. And since then, we've been on a plateau, a stable plateau, averaging 35 to 50 new cases per day. And that is good news. We have, however, had 43 deaths in our community because of the COVID-19 disease. And we've tested more than 21,655 individuals so far. We're going to continue to expand testing efforts, and we're getting even every day new testing partners are coming into the mix. There'll be announcements about that coming up in the next few days, I'm sure. For the state of Tennessee, 8,266 cases have been reported in our state as of yesterday at 2 p.m. Tipton County, Tennessee, 87 cases reported, 252 in DeSoto County, Mississippi, and 156 in Crittenden County, Arkansas at the end of yesterday. So looking at the fatality data, because this is the day where we do our updates on mortality, I believe you're going to see on the slides some information that we also have posted at our website, shelbytnhealth.com, which you can go to any day if you want to see the slides associated with these data. But so far, out of the 43 reported deaths, 62, almost 63% of those are among males and 37% among females. And then when we look at our racial distribution, we now have approaching 70% African American, 30% white. It's a little, that's the direction we're headed. So still disproportionate impact on our African American community, but the impact on fatalities for our white residents is also growing. And next slide, please. When we look at our fatalities by exposure type, for 42% of the people who have died, there is no specific documented exposure explaining how they acquired their disease. But 20%, or 1 in 5, had close contact with another case. 30% are healthcare associated, which includes our residents in nursing homes, of course, and hospitalized cases that acquired their disease because of a hospital exposure of some sort. And 7% are travel associated. Now, in the early days of the epidemic, almost all of our cases, in fact, all of our cases initially were travel associated, and that is no longer the case, but it's still significant that 7% of our fatalities occurred among people with travel associated exposures. But I want to finish with talking about the comorbidities. The most important comorbidity remains, and I'm sorry, this slide is not updated, but the 43 deaths show 78% of our fatalities have a cardiac comorbidity underlying. And that's very important. Most of those persons have heart disease, congestive heart failure, or high blood pressure. Some cardiac involvement, and simply being hypertensive, somebody who takes blood pressure medicine every day, that is a significant comorbidity and risk factor for poor outcomes. Also, we see respiratory conditions. About 29% have an underlying lung problem, either asthma, COPD, emphysema, or other damage to their lungs. 19%, almost 20%, are obese, and 24% have diabetes. Those 4 risk factors, obesity, diabetes, a respiratory condition, or cardiac problem, those are the 4 most important risk factors nationally, and they're also the 4 most important risk factors locally among our residents who've had the worst outcomes, including death. So if you're an individual who has any of those underlying conditions, or you have multiple of those underlying conditions, our advice is to please adhere as strictly as you can to the social distancing recommendations. Of course, if you do have to leave your house for any reason, frequent hand washing and use of hand sanitizer and wearing a face mask, a covering over your face, is the recommendation. But what's even more important as a recommendation is to stay home as much as it is possible to do so. If you have errands that need to be run, please have someone else run those errands on your behalf, and that will continue to reduce your risk of acquiring this virus out in the community. And with that, I will open it up for questions for either me or the mayor. We'll be happy to answer your questions.
Laura Testino with the commercial appeal.
Hey, I have two questions here. First for the health department and the second for the mayor. The first, I've heard from Christ Trinity Christian Academy saying that they have now been approved by the health department to resume operations with their preschool on Monday. And I'm just curious about that change in regulation and why it's now safe for that operation to continue.
I'm sorry, I did not hear, there was a chime over your voice and I couldn't hear what facility you were asking about.
Oh, sure. Sorry about that. It's Christ Trinity Christian Academy. The health department on Wednesday said that should the preschool reopen on Monday, that it would be in violation of the health directive. I've heard from the school today that they have been told by the health department, they say that is no longer the case. I'm just wondering if you can kind of clarify what has changed there since Wednesday.
I do not have any information about that, but our public information officer, Joan Carr, can get that information to you after the call.
Okay.
And then your next question was for the mayor, I believe?
Yes.
Okay.
This question is just kind of surrounding internet access. So latest data, Bureau latest census information shows that about 40% of the county is not online with broadband access. I'm curious if there are any initiatives or programs work in place to help those people get online in terms of letting them be able to find more resources, learn information about testing, and then as for students, of course, being able to get online to learn.
So I think Shelby County School System is working on a proposal that will gradually bridge the digital divide. I think, we obviously see lots of students that have access to the internet and access to devices that can get them on the internet, but too many of our students do not. And so Shelby County Schools have been actively working on a proposal, and I'm hopeful that they'll bring that proposal soon to the county commission and to their school board. So they're working on that. As for other ways to access the internet, our libraries and community centers and locations like that are going to be part of the discussion around this phased-in approach. And so very soon, I think we'll have an approach that, reestablishes opportunities for people to go to those public places and access the internet and, gradually bridge that digital divide.
Jessica Gertler with WREG.
Hey, my first question is, as the governor starts to gradually reopen businesses in other counties, it's likely we're going to see an influx of cases. And there's a concern that small community hospitals won't be able to handle that increase, therefore sending more of those critical patients here. Do you share that concern? And are Memphis area hospitals prepared for that? And then my second question is, you have testing appointments that are not being taken. Why won't you use that capacity to test healthcare workers who are symptomatic or maybe asymptomatic? Do you simply not have enough tests?
So yes, we are worried about the pressure on our hospital system as people who have symptoms utilize this part of the state. I've even got a list here about the number of hospitals in West Tennessee that have closed over the last few years, which have put a lot of pressure on Regional 1 and other hospital systems here. Of course, Shelby County government makes a pretty sizable transfer to make sure that Regional 1 can provide charitable care every single year. But still, because of the absence of Medicaid expansion, because of elective surgeries also being put off for now, hospitals are in a precarious state. And so we're working real hard to make sure that we can stabilize those hospitals. The decision on elective surgeries has really been a focus of a lot of discussions in the last few days, and I think that's also going to become part of the phased approach, because to the extent you can create revenue streams from hospitals like returning elective surgeries, they'll be in a better position to stabilize, to not furlough their employees, and to make sure that they have staffing and bed capacity in place when the surge occurs. And just by the way, for the record, if the legislature does reconvene in June, I think one of the topics that they should consider is Medicaid expansion, because that represents another way we can bolster hospital capacity to provide care in public health emergencies like the one we're in. So the list of hospitals that have closed in West Tennessee over the last few years, partly because of the absence of Medicaid revenue, is Gibson General Hospital in Trenton, Tennessee, Haywood Park Community Hospital in Brownsville, Tennessee, Humboldt General Hospital in Humboldt, Tennessee, McKenzie Regional Hospital in McKenzie, Tennessee, McNairy Regional Hospital in Selmer, and the Methodist Fayette Hospital have all closed in recent years because they didn't have access to some of those revenue streams that we could have in place if we were to draw down the Medicaid expansion money. I think there was another part of that another part of that question that David wanted to answer, so I'll leave it to David.
Just for the record, could you restate the rest of the question that we can address for you?
Hospital workers.
About hospital worker testing?
Yeah, we were just wondering if you have testing appointments that are not being taken, why wouldn't you use that capacity to start testing healthcare workers, whether they're symptomatic or not symptomatic, or asymptomatic, I mean? And do you simply just not have enough tests at this point?
That's not exactly the issue. We have plenty of tests available. We do have untapped capacity in the community test sites. In other words, there's more test appointment slots available than there are people asking for tests, but testing is a voluntary act. What we are still prioritizing through the community provided test sites are testing for symptomatic individuals, but we do have conversations going on with specific providers of test capability to route healthcare workers toward a place where they can be tested regardless of their symptomology. And then we're also working with the occupational health programs in the healthcare sector to make sure that testing of employees is available through their own organizations. But we want to preserve our test site capabilities in the community for those symptomatic individuals who would have no other route to be tested, and make sure that we're able to meet their needs as our first priority.
Jackie Massey with Fox 13.
Hi, happy Friday. I have two questions, both for Mayor Lee Harris and possibly Health Department if they want to add some input. I wanted to know, what would you like to tell the Shelby County residents who may travel to neighboring counties like Tipton County, who are reopening their businesses on Monday? Any advice you would like to give them, or any concerns about that and what that means if they come back to Memphis? Also, in terms of the nursing homes, I know we've been continuing to see cases in those facilities, and I know with the White House regulations, they're saying they wouldn't even allow visitors to go to those nursing homes until phase 3 if you follow that plan. And I know Harris was calling for stricter restrictions for those nursing homes and holding them more accountable. How do you plan on doing that? Do you have a plan in place or a proposal?
I'll answer the first part and then turn it over to the mayor. If anyone leaves Shelby County to go to any neighboring county or any other part of the United States where restrictions have been loosened, we would still have the same advice as before in terms of social distancing, hand washing, and covering your face when you're out and about, frequent use of hand sanitizer when you're not able to wash your hands. It's the same kinds of recommendations to protect yourself that we had in place prior to the Safer at Home orders here in Shelby County. Those are personal measures that anyone can take, and all of us should take when we're moving about in the world, because this virus is still very prevalent in the United States. But with that, I'll turn it over to the mayor.
So thanks a lot for the question. I think we're going to continue to be really aggressive on nursing homes, because that is a source that is a location with really high risk. I've already mentioned some of the things that we have done per the health directive of Dr. Randolph. So he has already barred visitation at those nursing homes and required fever checks and extraordinary protocols with respect to sanitizing those nursing homes. We'll continue to review and add additional protections for the residents of nursing homes, but we're also going to need partnership at the state level. I've already mentioned one law change in 2015 to make it so that owners of nursing homes would not be liable specifically for things that happen at nursing homes. That law, in my view, and I only speak for myself, has led to some of the understaffing at nursing homes and the absence of protections at nursing homes. And so I think owners of nursing homes, like owners of any business, should be held liable under certain circumstances, as that everyone has to be accountable, and we can't provide specific protections for nursing home owners that are not applicable for other kinds of organizations, particularly because the risk can be high if there is underinvestment and understaffing at those nursing homes. Additionally, I would suggest that we're going to have partnership to think about whether or not nursing homes should have insurance. Right now, nursing homes are not required to have any insurance, which is another kind of anomalous item in Tennessee state law, that you have to have insurance, obviously, to operate a car, and insurance to do any number of things. But operating a nursing home is actually a pretty high-risk activity, as we can see right now. And so maybe we should have a conversation on requiring insurance at nursing homes, because that may be also another way to offer another layer of protection for the residents of nursing homes. We're going to all have to try to do what we can where we sit to help protect nursing home residents, but there's a lot of levers that need to be pulled.
Kendall Downing with WMC 5.
Hey, everybody. Good afternoon. Two questions. First, kind of more for the health department. David, I was wondering if you all could talk about the outreach to various parts of the community. I know I was told that there was some advertising going on Hispanic radio, lower income Memphians. There's a lot of fear of the testing process itself. What's being done with respect to that in various community groups to try and increase confidence in getting tested? And then for the mayor, I'm interested in the reopening plans, and why is it so critical that everybody in Shelby County is on the same page? And I know Nashville kind of put out a plan yesterday. When do you all hope to be able to release that framework?
Okay. As far as marketing and outreach, there may be others who could speak to that more broadly, and I would encourage you to go through the PIOs, both for the city and the county, and the health department, to get more information. But what I know is that we are working with various individuals to create PSAs. There's multiple efforts to buy airtime on billboards, on radio and TV stations, to publicize the availability and importance of testing, to drive people's awareness of the signs and symptoms of COVID-19 and the importance of taking measures to protect themselves and others. There's a lot of different kinds of marketing campaigns being developed, but what I would say is that we will continue to be active in all the channels with all the sub-communities in our area to make sure that the information that they need to protect themselves and the ones they love is reaching them to the best of our ability to reach them. And with that, I'll turn it over to the mayor.
I think just pretty straightforward that the novel coronavirus does not recognize borders. And so if we don't have social distancing in one part of our community, but do have social distancing in another part of our community, if we don't really be aggressive around large gatherings in one part of our community, but are lenient with respect to large gatherings in another part of our community, then we don't do all that we can to slow the spread and ultimately defeat COVID. And so that's why it's so important that all of us, all of the municipal leaders in this community and across the state, continue to work together. And we've really worked productively together. As I said, I think consensus is probably days away at this point, not weeks away. And so, I think we'll be able to talk about that real soon. And by the way, just on some of what we are talking about, one of the things that I'll say we're talking about right now is just what are the indicators of success. And one of the indicators of success is the strength of our public health system, or our public health capacity. That is the health department. Whether the health department is at full strength, because it's going to be called on to do a whole lot of things over the long term, including to continue to investigate and contact trace for an ever-growing number of possibly growing number of COVID cases. So we want our public health department to be at its strongest possible capacity. And for that reason, I think very soon, in just a little while, we'll be back in front of the County Commission to talk about County COVID Relief Part 2. So we were able to get $2.5 million from the County Commission for County COVID Relief in the first instance, and I think we'll be back in front of the County Commission very, very soon, in less than 30 days probably, to make the case that we need an investment from the county to make sure that we can strengthen what our health department is able to do.
Bill Dries with the Daily Memphian.
Yes, you all talked about recovery numbers. I may have missed it, but did you run those? Because I'd be interested in kind of your thoughts on what the numbers mean as well as what the numbers are.
Sure. So recovery has a specific definition. And what it means is a person who was diagnosed with COVID-19 disease and 21 days later, they're still alive and they've completed all of the requirements of isolation that they were under. And so 870 individuals, or approximately 44% of all the cases that have been diagnosed, have reached that threshold and are now considered recovered. 2.2% of our population has died who was diagnosed. And the remainder are what we call current cases. Those are people who have been diagnosed, they're alive, and they're still battling the disease. So those numbers will be reported regularly now that we're deep enough into the epidemic that people have had a chance to be more than 21 days out and meet the definition that the CDC has for a recovered case.
Bill, did you have a follow-up question?
Yes, for Mayor Harris, when you talk about everybody being on the same page, and in particular in regards to funding for the Shelby County Health Department, is it possible that you will recommend some kind of funding for the health department by the other municipalities, including Memphis?
I hadn't thought about that, but I guess that's a good idea. So I'll leave the other municipalities to make their decisions about how they're gonna invest in a coordinated response. They've already been very effective at that. The city of Memphis has loaned officers to the health department to conduct some of the investigations that we're talking about, and so we continue to do outreach to everyone. Just yesterday, in fact, wrote an email to all the countywide elected officials, because there are a lot of employees that are not necessarily under my purview but are under the purview of other elected officials in this county. And so I wrote to them to say that they should also, if they're willing, to lend some of their employees to the COVID coordinated response effort. And so I think there's all kinds of ways people can help, and I think that I think you see everybody really putting their shoulder to it and helping with the COVID response. And by the way, this gives us an opportunity to shout out the Community Foundation of Greater Memphis, which is found at www.cfgm.org/COVID. You can go there and you can donate to help. They're creating a fund to make donations to all the nonprofits and agencies that are out there helping people in need.
We have time for one more set of questions. Bradley Broders with Local Memphis 24.
Thank you, everyone, for taking my call. Last one. Happy Friday, everyone. Mayor Harris, just following up with what Kendall asked. I know I listened into the governor's news conference at 10, and in the surrounding non-metro counties, he was talking about 50% at restaurants starting next week, 50% at retail. Would you anticipate the Shelby County / municipalities following a similar kind of setup? And also, do you anticipate, obviously the Mayor Strickland's extension is until May 5th. Do you anticipate Memphis and all of Shelby County, whenever that gradual reopening happens, it would be done at the same time? Thanks so much.
Yeah, I'm hopeful that we'll reach consensus and do everything at the same time. I'm also hopeful that we'll be able to align with some of the things that happen at the state level. We're obviously not driven by the dates that come out of the various, from the state or that you might hear elsewhere. We're driven by kind of what the data suggests on the ground. And so we have, the daily data that you see, and a lot more kind of indicators of success that we consider. But as far as like approach, hopefully our approach will align with some of the things we hear coming out of the state, and that there'll be consensus among all the municipal leaders. And I think that will be the case. And if we're finished with the questions, I want to shout out to the youth in Shelby County, like I did last week, because we're all making tremendous sacrifices, including the youth in our community. And so we've received a couple of questions from students at Presbyterian Day School. One question is from Lennox, who is in senior kindergarten at Presbyterian Day School. And so Lennox asks, is coronavirus over? No, coronavirus, unfortunately, is not over yet, Lennox. And it sounds like you are ready to get back to school and get back to your friends. And so I hear you. We also received a question from a third grader at Presbyterian Day School, Jackson. And Jackson says, if a person lives alone, is it safe for them to go and visit someone to keep them company? Yes, Jackson, with social distance. And we've heard really encouraging stories since this all began about people visiting their loved ones and friends and even strangers from time to time from the safety of their car. We've heard really encouraging stories about people leaving groceries on porches. And so everybody is really working together, and together we will all get through this. Thank you.
This concludes our briefing. Everyone have a wonderful weekend. Stay healthy, and we will see you Monday.